when it comes to protecting everyone in our schools. We are entering the home stretch for donations for the Coverings for Kids program, which will end next Friday, October 30th. As this final week approaches, I am excited to announce that Humana has partnered with us to donate 100,000 reusable masks to our schools through Coverings for Kids. This incredible display of support for our students and school staff comes at a crucial point in our fight with the virus. Thank you to Humana for doing your part to provide resources and encourage well-being in our communities during this pandemic, as can be seen in this recent health education event with the Louisville Urban League. Thank you for your commitment to get these masks to our areas that need them the most right now. Accessibility is extremely important, and it will make a great impact on the safety of those in our schools. With the addition of Humana's donation, we have now seen over 150,000 masks donated to our schools through Coverings for Kids. Thank you to everyone who has given time and resources to make this initiative successful. You are truly making a difference, and I encourage you to continue donating masks if you can. If you want to get involved, contact your local school district and visit firstlady.ky.gov/coverings for kids for more information and resources. Second up, answering the call. As we continue to see rising cases of COVID, it's especially important to use the 10 steps to stop the spread of the virus. I know we mention these steps a lot, and every day at 4 when I watch Andy, I hear them and I think, again, but yes, again. It's important. It's important because we need to be committed to taking these actions. One very important thing you can do is answer the call from our contact tracers. Our contact tracers are doing an amazing job of identifying people who have been exposed to the virus and asking those individuals to quarantine so that the virus does not continue to spread to others. Our family received one of those calls, and I'm happy to say that today we tested negative for the 4th time. So while the end of quarantine is in sight, it's important to know that you need to answer that call too. We know that quarantine can feel like a long time, but we did our best to stay positive, and we're grateful for the time we had together as a family. And most important, we feel good that we did what we had to do to ensure that other people were safe. Not knowing whether or not we had the virus, it was really important that we stay quarantined until we knew for sure. If you receive one of those calls, answer it. Please listen to the guidance from the health experts. Remember to keep following each of these 10 steps every day so that you can minimize the risk of catching and spreading the coronavirus to those you love, to your friends, to your neighbors, and to people you have never met. Please answer the call. Third up, Halloween safety. Halloween is right around the corner, and it is one of my favorite holidays to celebrate with my kids. Like many other holidays and special events this year, we need to reevaluate how we celebrate because of COVID-19. I know this has been a challenging year. We continue to have to make sacrifices. But just because this won't be an ordinary Halloween doesn't mean we still can't make it special for our kids. There are plenty of ways to get creative and have fun while staying safe. If you've been around the Capitol lately, you've probably seen that we've had a little bit of fun with decorations outside the governor's mansion this year. Decorating your house or yard is a great way to have fun with your family, and getting out for a walk or drive around your neighborhood to look at other people's decorations is a great way to stay safe and be in the spirit. Just make sure you mask up and social distance when you come in contact with others. Whether you've splurged at the Halloween aisles in the store, carved up a couple of pumpkins, gotten the kids involved in handmade holiday crafts and treat making, we'd love to see how you're celebrating Halloween safely this year. Tag us in your Halloween fun by using the hashtag HealthyHalloweenKY on your photos. If you are making Halloween plans for your family, please look at the guidance from the Department of Public Health and any guidance put out by your local community about how to celebrate safely. Fourth up, positive social media and the Mask Up KY campaign. Finally, Finally, we have some social media that is positive with the Mask Up Kentucky campaign. This is Jennifer from Northern Kentucky. She and her daughter are reminding us to prioritize our health, which is so important right now. They both got a regular checkup at the doctor's office, got their flu shots ahead of flu season, and are masked up for all of it. It's a good reminder that when we prioritize our personal health, we can actually look out for the health of others as well. Next up, this young lady is setting a good example for all of us by wearing her mask. If our youngest Kentuckians can wear their masks with a smile, all of us can. Plus, it helps if you pick out a really cute mask like she did. Thank you for sharing that. Let's see. Finally, we have Mr. Joe. Mr. Joe's church put together blessings in a bag to donate to Ashland Elementary School. Thank you for supporting our students and for masking up to protect everyone who generously gave donations. And I think it's safe to say that we all need a pair of those pajamas. Thanks to everyone out there who is doing their part to mask up and keep their fellow Kentuckians safe. Let's keep looking out for one another. I know we'll get through this together. And now I'm going to turn things over to Andy.
I want to thank the First Lady for doing such a great job and for incredible concentration, because off camera, Winnie was attacking a couch, and I'm pretty sure the couch was winning. But thank you for everything you bring. She's over there. Everything that you bring to our lives, and I couldn't be blessed to quarantine with anybody more than you guys. All right, today, both Brittany and I are wearing purple because October 22nd is Wear Purple Day. This is to make sure we are supporting survivors of domestic violence. This one was sent to me by Greenhouse 17. They do a phenomenal job. We appreciate them. Folks, we have more affliction out there than just COVID, and we have a duty to address all of it, even if we have to work for a better world against all of these scourges all at the same time. So please do what you can to help in this cause. Our COVID report today, it's a lot like the days that we've been seeing this week. It continues to be too high. But I want to make sure you know that we are truly seeing this surge all over the country. Let's show the clip on Florida. So many of you all remember how hard Florida got hit in July. It made it pretty much the second hardest hit state during this coronavirus, but they're already back, seeing difficulty, seeing rising case numbers. Of course, they lifted restrictions very quickly after some real devastation, and they are already seeing a surge again. This is happening in just about every part of the country when we're seeing thousands upon thousands of cases. And after cases, what we see are increased hospitalization. That's what we're seeing in Utah, where their governor is warning of hospitals filling up as COVID cases continue to spread. Remember, if you have a lot of COVID cases, even if we're doing a real good job of treating it, the hospitals start to fill up because a certain percentage of COVID positive individuals are going to need hospital care. And then when we're now seeing, at least in Wisconsin, hospital space run out. They just admitted their first coronavirus patient to their field hospital. Again, this is something that we don't want to see here. Huge surges in cases, increases in hospitalization and ICUs, and ultimately that additional extra harm and loss of life that can come when our healthcare system gets taxed too much. Now, we were very worried about this in March. We weren't as worried about it in July because while our cases were going up too much, we weren't seeing as big of a correspondence, though we did see an increase in hospitalizations and in the ICU. But let me show you a line graph now that goes back to that time, the July surge, and the July escalation and forward. So this is our inpatient census in our hospitals. You can see when we had more cases over the summer, we did have an increase, but look at where we are right now, especially since about the 20th of September, on a very steady increase. What we were seeing until that point, really until the end of August, was really good practices out there. That's the way we stopped that summer escalation. A lot of people wearing masks, a lot of enforcement of the mask mandate, and people just being really conscious of what was going on. And then we had kind of the traditional first start of school, just that period of time where we now know that we feel it internally too, in our rhythms, and being a little more casual. And then we see, as cases have increased, you see the hospitalizations increase. Same thing in the ICU. If you could bring that one up, James. Yeah. You see where we are now. We had held steady. We're generally steady for a long time, but now seeing a real increase and escalation that continues to rise. And today's numbers show that we are continuing on that trajectory, because today we're reporting 1,330 new positive cases of COVID-19. That is our fourth highest day ever, though it feels like we are saying that just about every day. 181 of them are 18 and under. Our total cases now, 92,299. Again, more cases than we ever wanted, and we can't be having more than 1,000 cases every day throughout the week. Currently hospitalized, 800. That's 800 Kentuckians, steadily increased every day. Currently in the ICU, 214. Yesterday was 203. So we have 11 more Kentuckians fighting for their life in an intensive care unit. And this one is striking. 105 Kentuckians on a ventilator due to COVID. That's up from 94 yesterday. And our positivity rate, 5.3%. That's the highest since August the 19th. So we are not just planning for how to deal with the surge that's going on, but we're going to be looking for additional recommendations that we can make to communities. We're going to be talking to the hospital systems that are out there about helping to get the word out. The difference between now and in March is we know how to stop this virus. Those 10 steps will work. Question is how we increase our compliance across Kentucky, because that's how we can have the most effectiveness. When we look at where it's hitting today, 272 new cases in Jefferson, 115 in Fayette, 37 in Nelson, 36 in Hardin, 35 in Warren, 33 in Barron, 29 in Shelby, 27 in Davis, Laurel, and Madison, 24 in Marion, 20 in Boone and Henderson and Scott, 19 in Christian and Hart, 17 in Bell, 16 in Meade, 15 in Callaway, Jessamine, and McCracken, 14 in Kenton, 13 in Bullitt, 12 in Allen and Campbell, and 11 in Clay, Grayson, Perry, Pike, and Rockcastle, and 10 apiece in Lee and Muhlenberg. And when we have a lot of cases, ultimately we have more death. So today we're reporting 17 additional Kentuckians that we've lost. When you think about yesterday being, I believe, 21, the second highest, and today being 17, these 2 days, they're painful. Painful to our Commonwealth, painful to our families. We've now lost 1,380 Kentuckians. That is a dramatic loss of life. And I hope that we realize how serious this is that we are in, but also how many families out there that have lost a loved one that want us to do the right things so that others don't lose a loved one. I include a 69-year-old woman from Allen and a 74-year-old woman from Allen, 73-year-old man from Fayette, a 78 and a 60-year-old woman from Greenup, a 65-year-old woman from Hancock, a 64-year-old woman from Hardin, 52-year-old man from Henderson, 95-year-old woman, and 84-year-old man, both from Jefferson County, 87-year-old man from Jessamine, 93-year-old woman from Knott, 77-year-old woman from Lee, 76-year-old man from McCracken, 63-year-old man from Nicholas, 87-year-old man from Rockcastle, 96-year-old man from Scott. And one of the people that we lost today was a long-term care worker, which I know is especially hard given that those workers oftentimes walk into a dangerous situation each day, but they know there are people there that need our help and need that care. So those are 17 families that are going to be struggling, and we need to show them our support. Let's light our homes up green at night. Let's ring those bells at 10 a.m. every morning. One Kentuckian lost is too many, but this is far more than one. Long-term care facilities, 69 new residents, 56 new staff, 7 new deaths, again, including that one long-term care worker. On schools, this is from the dashboard that is done every day, not our longer audit. Reported yesterday for Wednesday, 73 new cases for students, 73 new student cases, 31 new staff cases, 585 new students quarantined, 85 staff quarantined. So for this week, Monday through Wednesday, 278 students testing positive, 157 staff members, 2,455 students quarantined, and 409 staff members quarantined. So again, while we see this surge going on all throughout the country, I know that we have fought and defeated escalations twice. We can do it a third time. It just takes all of us working on Team Kentucky and working together. Let's talk about Halloween. That's the next big thing that is coming up. I know the First Lady touched on it, but for safety's sake, with where we are right now, what I need you to do is to make a plan. You need a plan because our kids are excited. They want to have some way to celebrate Halloween. And now's the time to make the plan and to explain your plan to them on how to do it safely. The White House says we are in the red zone for cases. That's something that we have been telling you, but it means that, again, Halloween this year, if not done correctly, can be a little more dangerous. So how do you do this safely? And what should your plan include? Number one, everybody has got to be wearing face masks. And that's not the masks that they might pull over that. It's what we need you to be wearing each and every day. You need to sanitize your hands often and maintain 6 feet of distance from others. We need to make sure that it's only family groups that are going out to trick or treat. I know kids and parents like to be in larger groups as the kids run through the neighborhood. That is not safe this year. Make sure that at your home, the way you're giving out candy needs to be different. You can't be holding the bowl. You can't be individually handing it out. That will spread this virus. What we need you to do is either put out a table or spread out the individual candies on your driveway or on your front porch. Before you set them out, sanitize your hands, place each one down. If you've got to reload or restock at any point, sanitize your hands again before doing it. And then step on the other side of the glass of your door so that those kids can be safe. So the virus didn't spread at your house, just the fun that is Halloween. Those are some really small sacrifices that we can make that will keep kids safe. Parents, make sure you have the wipes when you get home to wipe down the individual candy wrappers. Let it sit there for just a bit, and then I know your kids will enjoy. Remember, the CDC doesn't think we ought to be trick-or-treating at all. I know people are going to do it. I know how excited our kids are doing it. So please make your plan on how you're going to follow these steps, where you're going to go. You really should do fewer houses this year. Allow people to get the experience. Also, make sure you're not going to large mass gatherings. And we've been hearing about festivals. We can't have large Halloween parties, things like that at a time when the virus is spreading. And adults, I know it's a time that can be enjoyable, a time that's important for various groups of people out there, but we need the sacrifice from you this year to not have Halloween parties at all. We need to make sure the kids have an experience, but this is our COVID year. We're going to come out of this, but the amount we sacrifice right now is going to be directly related to how many people we do or do not lose. So again, it's a sacrifice, but I'd like to think that it is a small sacrifice to better protect our people, our children, our seniors, all of it. So we're now going to kick it over to Dr. Stack, but I'm going to read him a question that comes from one of our reporters that is about what he is going to at least start talking about. And it says, could Dr. Stack please go over the updated CDC definition of close contact, and does he agree with the new guidance?
Thank you, Governor. Hopefully you can all hear me okay. So to this specific point, James, if you could show the 2 slides that I have. So the CDC apparently changed its guidance yesterday to redefine how a close contact is defined. I'll be honest with you, I'm a little perplexed. I understand why this has gotten some attention, but it really doesn't represent a meaningful change here in Kentucky. So you all should know at home, it doesn't really change how we're operating here. So they released a study about a prison guard who was exposed to, I think, 6 or so other inmates, none of whom he was exposed to for more than a minute at a time. And they verified this by video camera surveillance in the Correctional Institute. And this individual developed COVID-19, and they can't find any other exposure that he would have had, this correctional officer. And so the conclusion reached by the authors of the study was that the cumulative exposure this person had to these individuals probably resulted in his infection, which means that it wasn't sustained contact with one infected individual for 15 minutes or more. It was exposure to multiple individual people for small amounts of time that totaled more than these 15 minutes. And so this has led apparently the CDC to adjust its guidance. And you can see on the right-hand side, I cut and pasted from the CDC's website this afternoon, where they describe the sorts of interventions that they recommend are going to be necessary, or where they've changed things, where they identify that growing evidence of transmission risk from infected people without symptoms, people who have no symptoms, occurs, and also occurs in people who become symptomatic, but before those symptoms develop, meaning that we know that people spread this who are unaware that they are even infected because they have no way to know this unless they've been tested. They also urge us to continue to remind people about the need to communicate to the public the importance of wearing a mask, social distancing 6 feet or more, washing your hands, covering your cough, and practicing staying home if you're sick. So James, if you could show the next slide. I just want to reassure Kentucky that on October 21st, the CDC may have changed its guidance, but here is the state of Kentucky's guidance that is from September 18th. And so this is how we defined an exposure in the state of Kentucky more than a month before today's news for the CDC. And if you may not be able to read this, obviously, on the news conference, but if you were to look at this document, which is posted on kycovid19.ky.gov under the healthcare tab, you'd find that we have defined as a contact a person who has close interaction with a confirmed or probable COVID-19 infection. And we say here that it is for within 6 feet and for greater than 15 minutes with or without a mask. And we talk here in the next sentence that it does not necessarily need to be a consecutive 15 minutes. This is where professionals in public health through contact tracing will talk with individuals who may have had an exposure and discuss with them the circumstances of their interaction with an infected person and make an informed professional judgment based on this and other guidance, whether or not an exposure is likely to have occurred, and then give very tailored and custom advice to the individual. So on this point, let me just conclude. I'm very proud of our team. I think we have had multiple instances now where our guidance has been ahead of the curve. We are going to continue to work at that and try to keep Kentuckians as safe as possible with the best guidance. But I'm going to emphasize at the end here, in order for all of this to work, people have got to follow the guidance. It doesn't make a difference if you consider yourself a VIP, if you consider yourself someone special, everybody special, or if you are, regardless of what setting you're in the state of Kentucky, if you have a high risk exposure, we're going to expect you to quarantine. And that's how we keep the disease low. And the sad irony in this is when people disregard this, that's when the problem gets bigger and bigger, and more people are affected by the interventions we have to take. So if you get a call and you're advised to quarantine, I really urge you to follow the great example set by the First Family here in Kentucky, because the governor, the First Lady, and Will and Lila have successfully completed here within the next day or so their 14-day quarantine. And I think they've set the right example for the people of Kentucky. Thank you very much, Governor Beshear.
More questions here. We'll go through all of them. Are we seeing increased enforcement of COVID-19 regulations as we requested? We are. It is uneven in some areas, but we are seeing a stronger push. That's not just state agencies, that's also localities, counties, and the rest really stepping up, sometimes the encouragement, sometimes the enforcement. But let's admit that we can't enforce our way into really good practices. We have to encourage our way into good practices. And that means all of us doing our part, but also making sure that if we are in an establishment that's not following the rules, that we say something. We do it nicely, but we still say something, because it's a shared social responsibility when we are all connected like we are right now to make sure we're getting the job done and protecting one another. What's my reaction to the Purdue Pharma guilty plea? Right now, I believe it's just the company. I seriously hope the investigation continues on the family itself. This is a company and a family that has poisoned our communities, that was the leader in this flooding of opioids and has to be held accountable. The proposed financial settlement, I think, is too small. For all the damage done, I think it's too small. Can we have an update on my security detail who's tested positive for COVID? He still has some symptoms, but I know he's going to be okay. But he is still working on beating this virus, which I know he will. But I think that says to all of us that it's a powerful virus, and no matter how strong you are, it can potentially cause complications and or keep you out of work. Or on the shelf longer than you would have thought. We need to respect it, the virus. We need to be humble about it because it is aggressive and it can be deadly. Yesterday, Governor Holcomb, that's Indiana, announced the National Guard would be assisting nursing homes and long-term care facilities to take the load off exhausted employees. Would you consider this in Kentucky? And how is the state preparing for these major spikes at these facilities? That's something that we would certainly consider if necessary. We have been working with our long-term care facilities in so many different ways, especially on the testing side. But we'll need to work even closer as this surge continues. I want to make sure I make the point that we're working really hard, and every facility is working hard to keep COVID from coming in the doors. And let me say to the workers in our facilities, thank you. Thank you. You walk in every day in a situation that could be dangerous. And I know, some people talk about COVID fatigue just for wearing a mask or having to hear about it. Think about what you are doing. Now, that's real fatigue. And we need to have your back. We need to be wearing masks. We need to be engaged in social distancing, because the key to keeping you safe and that long-term care facility safe is to lessen the spread in the community itself, because it never just pops up in a long-term care facility. No one intentionally brings it in. But when we have 8, 9, 10 red counties all around each other, the level in the community is so much, it's going to get in one of those facilities. So we all have a responsibility. The answer isn't just locking down everybody who would be vulnerable. It's tamping down the level of the virus to protect those individuals that are vulnerable. We're looking at even increased testing right now with some new testing that's been provided to us, but we don't test our way out of this. We engage in good practices. We band together. We do the right things. That's how we defeat this virus, and we protect everybody in that long-term care facility, including the worker that we lost today. Media reports say China has implemented major shutdowns and then quickly used contact tracing for each relatively small outbreak. Is that the only realistic way to bring the number of cases down? No. We all believe that if 90% of people would wear masks when they need to, we get this thing under control. That social distancing, following the top 10 rules, is right there. It is right there. It's in our hands. We have the power to protect people from this virus and to get closer to an old normal until a vaccine is here. That's the big difference between now and March. We know how to do this. The question is, are we willing to? And we need to answer that question with the affirmative. It's got to be yes, because if it's no, we lose more people around us. It's got to be yes. We're in the business of saving lives right now, folks, every single one of us. It's your job. It's my job. It's all of our jobs. So let's do it. Where is the current increase being seen the most? Certainly, we saw a lot in colleges, but that's a lot of people together, and we're starting to see that de-escalate at the moment. Family gatherings right now is where we're seeing a lot of spread, where friends or family come together and let their guard down. That's oftentimes at a home. Sometimes it can be at a coffee shop or a restaurant. Weddings and funerals are tough too, and some outcomes that we've unfortunately seen, some tragedies. So we need to make sure that we act the same way with regards to following the rules at our family gatherings as we would at anything else, because I know you don't want to spread this to anybody out there. We certainly don't want to spread it to our family members. So let's do what it takes. Let's remember that if we don't do what it takes, the next person who gets the virus could be somebody close to us. Let's live our faith. Let's treat our neighbor as ourselves. Let's pass what is a small test compared to what others have had to endure, what our grandparents had to endure. Our Eastern Kentucky consistently registers some of the highest unemployment rates in the state. Is any progress being made to help process some of those claims, or any upgrades to the system that would allow people to get their calls and concerns answered? And one of the biggest challenges here is what wasn't done before the pandemic. We have a 20-year-old computer system that was never meant to handle the volume of claims that we see, that should have been upgraded long ago, and fully upgrading it in the midst of a pandemic just isn't feasible. But we have been able to put about $4 million, I believe, of upgrades into it that is helping to address some of that. And we've gotten our initially filed March claims down now under 1,000. I think that's going down pretty significantly as it goes. We are then better able to address the pandemic claims, because if you're denied a traditional unemployment claim, you may be able to qualify for pandemic unemployment, but you got to get through that first process and then qualify for the second. And remember, this is a system that the federal government designed to tell you no. First, it told more people no by percentage before the pandemic than during it. In other words, we are getting more people approved by a percentage during this pandemic, even with the large volume, even with the technological issues, than we're getting approved before. The second thing is they set up so many different ways for you to make mistakes. You know, you got to apply originally and get approved. Then you got to sign up in the system. Then you got to request. every couple of weeks. They made different rules for the new $400 supplement than they did for the $600 supplement. And then there are different rules for pandemic. So they've created all these ways for people to trip up. And so what does that do to our volume? Well, we have a historic volume that have filed their initial claims. We have then significant numbers of pandemic claims to try to get people signed up. And then with the system that the federal government has designed so that people accidentally make a mistake and might not get a second or a third payment until it's fixed, you add that volume onto the top of it. I mean, we're working with a system where they cut in the budget years ago, 90-something people. They closed all the regional offices. We've got this computer system, and then the federal government wants to tell you no. It's upsetting. I know people need help. I know we haven't been fast enough to do it. But I do want you to know we do care, and we are working our hardest. Those aren't excuses. Those are the challenges we have to overcome, and they are substantial. But we are going to continue, and please blame the system, blame the federal government, blame the state, blame me if you want to. But don't blame the hardworking people that are trying to get through those claims, processing them as quickly as they can. They are working as hard as they can. And while unemployment we wish had gone faster, I am so grateful for all the ways we've been able to help people during this pandemic that have worked incredibly well. Signing people up for health care, especially Medicaid, has gone exceptionally well. Making sure somebody can see a doctor during a pandemic is necessary. And I'm glad that people have been able to do that. We provided more food assistance than ever before, getting round after round after round in. I was talking to our Commissioner for Public Education for the tens upon tens of millions of meals that they've delivered. And then there's our group that does it for seniors. And then there are so many local groups that are stepping up and doing it too. We've been able to provide $15 million in eviction relief. We're providing $15 million additional dollars in utility relief to make sure that people don't have that cut off, and a number of other areas where we're trying to help not people just get through this, because we will get through it. We'll get through it together, but I want you to get out of it without having that significant debt that can pile up during it. So we're working hard. And I know a lot of other people are working hard out there trying to take care of people through this, because we're going to make it. We're going to be out of this. The vaccine is coming. We think at either the end of this year, the beginning of next year, we'll be deploying it as quickly as we can. We're going to get out of this. But we want to save as many lives while we do it. And we want as many lives to be whole so that we can come out of this, not stumbling and not gasping for breath, but truly sprinting into the future. And that means something this week, because we see a lot of our future happening right now. We just opened the largest greenhouse in North America yesterday in App Harvest in Eastern Kentucky. It has the most complex LED lighting system anywhere in the world. And we're doing it right here in Kentucky. And that company has already broken ground on a second site. We have $1 billion plus steel manufacturing facility breaking ground tomorrow. That's going to create 400 jobs at $70,000 plus dollars per job. And that's just the start. There are so many of those other opportunities that are out there, and COVID is rewriting the rules. People are now not looking to go to a densely packed place like New York and Los Angeles. Density is not a good thing right now. That's going to make us more competitive in all the different things that we can offer. So we want to make sure that our people are in a good place to take advantage of these opportunities, that are in a good place to be our workforce of the future, that we're getting more of our kids educated, highly educated in a skilled trade, and a lot more kids through college. I believe that there is such a bright future out there, but we have to buckle down and to do what it takes to successfully get through this virus. Every major economist says that the health of our economy isn't based on the restrictions that we put into place. It's based on how well we manage the virus. If it continues to escalate, get out of control, people lose confidence in the safety of the places that they go and they spend their money. We get control of it. we enforce masks, we wear them, we do what it takes, we tamp this down, we see our economy flourish. And finally, to get where we want to go, the federal government has to step up and act. Right now, if there is not another CARES Act, all the funding for the testing we're doing, for the assistance to nursing homes, for the contact tracers, 600 plus that are out there, for the extra individuals we've been able to provide to our local health departments, for the extra payments going to our local health departments, for this comprehensive approach that we've put together to fight this virus, all of it gets defunded December 31st. That's fallen off a cliff, and we can't let it happen. And so many other areas need to be addressed. The supplemental $400 or $600 payments have been good for our economy, and people need that help. Congress needs to act there. And then budget stabilization. Without another CARES Act, we can get through this fiscal year, but the next one will be devastating on a state and on localities, and that'll make our recession longer and tougher, and it'll make it more challenging to get the services out there that we need. So, time for Congress to stop acting like Democrats or Republicans, to even put an election on the back burner and to sit down to hammer out a good deal that's not good for one side or the other politically, but is good for the American people. So that's where we are. It is the end of Thursday. We'll be back live on Monday. I'll look forward to that. And while quarantine has made all of us a little stir crazy, I've gotten to spend it with the three people I love the most, and our dog too. Our dogs enjoyed it the most. Stay safe this weekend, and remember that we'll get through this, and we'll get through it together. Thanks.